This is Hold My Stethoscope.
Hey everyone, welcome
Hi.
back. I'm Brittney and I got my girl Felicia
Hi,
here.
everybody.
So grab your stethoscope and listen in because this week we're celebrating the incredible ER nurses out there holding it down shift after shift.
Yes. Hi, everybody. It's your girl, Felicia. It is ER Nurses Week. Happy ER Nurses Week, everybody. And we wanted to take a minute to recognize you, the nurse behind the chaos, the calm in the storm, and the one who still shows up with heart.
And while we're celebrating, we're also talking about something real, mental health. Because behind every smile and every code save, there's a nurse carrying a lot.
Thank you to everyone who's been listening and watching Hold My Stethoscope. Keep those messages and shares coming and stay tuned. We'll be announcing soon how you can send in your own stories to be featured in future episodes. Yay!
We also do just want to point out you may be listening to this at a later date, but we are filming this during ER Nurses Week and Mental Health Awareness Day. So while this may come out a little bit later, we really wanted to spend a whole episode touching on these two important topics.
Absolutely.
All right.
So, yay! Let's reflect on what this week represents: recognition, community, and gratitude. So, Brittney, do you have a favorite ER memory or why you fell in love with emergency nursing?
That's a tricky one because I didn't initially think I was the right fit to go into emergency medicine. I thought I had more of an ICU personality and I wanted to, go into critical care. Well, that just didn't end up being my journey. And now I know why. It's because when I came down to the ER, I fell in love with it. And it's hard because we talked about this in our very first episode of how it's kind of a toxic relationship, but if you found your passion there, it's amazing because you really do see people at their absolute worst moments. You get to see every literal lifespan from newborns to elderly patients. You get to see anything from somebody coming in because, they stepped on a nail to they've got a toothache to they're literally coding, they've had a traumatic injury, but they're giving birth, having a heart attack, they've just,
Absolutely.
got belly pain. I found that love in it and kind of that satisfier of my ADHD by being able to kind of not know what to expect the unexpected, and just really being able to test all the skills of nursing because as an ER nurse, you are, the master of none, but the knower of all because you have to. So I don't know if I have a favorite ER memory because I feel like I've taken something from every place I've worked, from every person I've worked with, and really share something special with them. But I just know as my time in the ER, I have loved it. There were moments where I'm like, I can't do this anymore. This is too much. You get those moments, but I really do love the ER. So, what about you?
Boy, so with my entire nursing career background being emergency room nursing, from the start, I knew that the floor nursing was not for me. And my hat goes off to all those that work the floor. I mean, we need you. We all serve a purpose.
Mhm.
I knew that wasn't for me, just as many nurses on the floor would say that emergency life isn't for them. But I've had some of the most amazing moments in the emergency room. And one that I think back on, I'm not sure if I shared this story, but there's a reason why hospitals make sure that you have a badge.
Know this story. You haven't shared it yet. Great story. Love it.
It is very important that all employees have a badge. And there's a reason that I am telling you this. Many years ago, when I was working night shift, so that was many moons ago, as a nurse, I was an LPN, but I was going back to school for my RN. but we would have the time of our lives in the emergency room. We were so what you would call just not it's funny, but not probably funny. I mean, we just did whatever we wanted. Let me just put it to you like that. And everybody knows who work in hospital settings that certain codes are called for certain reasons, and it's to be on the lookout for certain things that's going on. So there was a situation where there was a certain code that was called in the hospital. And the organization that I work for actually has another hospital that would be right across the street from it. And so we would get all the code, each hospital, even because they were connected, hear the codes on both sides. And, of course, there was a patient, and I'm not sure if the patient had some mental health issues. As a matter of fact, I am sure that the patient had some mental health issues. But there was a code that was called over at the hospital across the street that was affiliated with the one that I was working with. But you know what? It was across the street. So many years ago, I mean, and even now, if it's happening across the street, there are people that would handle that. However, this is where the badges come in at. So this was during a time when, and it's still like this, when there was such a shortage. So you would take all the help that you could get, especially in an emergency room setting. And I remember working out in the triage area. It was hilarious because we actually had people working out there that they weren't probably trained for it, but you taught them and then they knew it and they ran the actual area. It was great. When I think about it, it's just absolutely hilarious, but it was absolutely great. So evidently, this particular patient that was the mental health patient from across the street had come over to our hospital and she came right to the emergency room door. Okay. And at that time, there were no set colors to be worn. You could wear whatever color uniform, and I never forget, we would even be able to wear, like, we would wear T-shirts. It wasn't even necessarily that hospital name on it, but we would wear T-shirts just to be matching with the little scrub pants or whatever, because this is kind of where it was. So if somebody came across and they didn't have a badge, but they said that they were here to work, then we would put them to work, honey. We would just make sure that they got some kind of sticker, almost like how you get the visitor stickers now, something that showed them to work. And I don't know if we even were doing that back then. However, this person walks in the door. Now they're in scrubs. We didn't ask them anything, but we told them, are you here to work? Well, they proceeded with the answer of yes. So what did we do? Put them to work, right? Now, this is where it gets a little strange, okay? When there are certain things that need to be done in a particular area, you expect when a nurse or a patient caretaker or someone, that is a clinical that's being sent to you has an idea of how to work the equipment. But it didn't matter because we weren't judgmental. We taught you how to work the equipment if you didn't know how. And that's exactly what we did. So this person comes in, and lo and behold, we voluntold them they were there to work with us. And you would have thought the light bulb would have went off when the blood pressure cuff was put on backwards. But no, 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 no. What did we do? Teach them how to put it on the correct way. Or if they needed to do an electrocardiogram and they put the stickers on in all the wrong place, what do we do? No, no, no. We put them and showed you how to put them the right way. So let me tell you the moral to this story. The moral to the story is that the person that the code was called on that had the mental health issues across the street was the person that came into the front of the emergency room at that time. We put that person to work because we voluntold them that they were there to work. We should have been alarmed that the person had no idea how to put the blood pressure cuff on or how to do the EKG, but no, 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 no. Instead, we taught them. And we allowed this person to work an entire 12-hour shift, honey. Mind you, no badge, no nothing. And what did we do at the end of the shift? And laugh to find out this was not a tech. This was the mental health patient from across the street that we basically worked an entire shift. Therefore, she didn't get paid. No, she didn't. She didn't get paid at all. And what did we do? We just left. We didn't even know it. But this is the reason why your organizations are all over you about badges, because you know what? It's because of us. Badges were not something we got in trouble for back then, nor did we ask for. And we allowed this person to come in, taught them how to do the job, let them work an entire shift. And they did not get paid. So it's very important that you all know the importance of a badge and the importance of not assuming that someone is there to help you out because you just want a extra set of hands. Because you know what? This was a mental health patient that they was actually looking for from across the street that we literally didn't even consider that. Worked her an entire 12-hour shift and she didn't even get paid. And guess what we did at the end of the shift, sis? We left. We thought nothing of it. And then we got in big trouble. Guess why?
That's right.
Because nobody ever asked about a badge. And this is why your organization mandates that everybody have on a badge. And when you don't, you'll get a write-up or you get a verbal. They are serious about that, people. You can thank us, and I do apologize at this time, but those were some of the most memorable stories that I have, and one of my favorites from the ER. And I can't tell you guys nothing, but I just love, love, love being an emergency room nurses. You can't make this stuff up.
Well,
You
it's
can't.
literally like the age-old adage where like, "We'll just take anybody. If anybody comes here to work, we'll take them."
You here to work? You here
Felicia
to
and
work?
her department friends at that time really took that to heart. Like, "Oh, you're here to work? Alright, let's come on in."
We told him he was here to work. It was the best.
So just
I'll
beware,
never
if you're ever an ER patient, they may put you to work.
Now you better have a badge because I'm not getting in no more trouble behind people just putting people to work without a badge. I want to know where your badge is. And if you left it at home, then I'm sending you to security
Oh my god.
because I don't want anybody to put you to work because they will.
Listen, that's why I said ER nurses are like the Wild West. Like the ERs are just they're a wild place. And
Which
that's
is
why I feel like sometimes like, you don't choose the ER, it just chooses you.
it
Like you
pushes
have
you
to
and it
be
takes
part of
what
that.
a
This
special person, right? It takes a special person who you got to be able to let things slide off your back because if you can't, you just don't belong there. I'm gonna be honest. You just can't. You just cannot take it to your heart. And I'm gonna tell you now, snitches get stitches. So be careful. We're not violent, but we don't play that.
it
You
is. Nurses are their own, ER nurses
yeah.
are their own special breed. ER people are their own special breed. And, it takes one to know
It
one.
does. We're not here to bathe you. Know that. We're gonna try and take care of you and get things all going, but we're not here to bathe you. Know that when you go to the emergency room. That's different from when you go to the floor. So just know it takes a special breed of nurses to be emergency room nurses or anybody, not just the nurses, anybody that's working in an emergency room setting. All know this. It's not an easy place to work, but it is a fun place to work.
It is.
Had some great
It's
times.
wild, and I couldn't imagine not being a part of it. Like, it's
Me
just
either.
it's
Me either.
crazy and wild and fun and chaotic and, all the adjectives, it's all of them. So
It is. It is.
but on the flip side of that, I do feel like, it is important to discuss, the emotional toll that an ER nurse is. We're all sorts of funny and a different breed and all of that stuff, but there's also a very real mental and emotional
Yes.
toll that ER nurses take. And this isn't negating any other specialty, but we're both ER nurses and it's ER Nurses Week, so we're gonna,
Let's talk about
spotlight
it
them a
now.
little bit.
That's right.
Um, I've talked about this, like my personal TikTok before, but really want to dive a little bit more into compassion fatigue and burnout and kind of that like secondary trauma that comes with taking care of some of the patients that we have to take care of. It's like I said, especially in the emergency room when you're dealing with the frequent flyers or the high utilizers or whatever you want to, call them, is they take a lot out of you,
They really
having
do.
to deal with the same person with their mental health or substance abuse or drug use or, just social issues like over and over
Over.
and over
Yeah.
again. That does give you compassion fatigue. Like, you're spending all this time, effort, and energy on somebody who just keeps using the system and not getting better, whatever the case may be. And you start losing that. You start losing your compassion, or you
Right.
get really burnt out from taking care of like high acuity patients nonstop, or mental health patients nonstop, or just, patients who are angry and yelling and cussing and just all of these things, that causes burnout where you lose that nurse, that like essence of being a nurse. Gets lost because we're just taking so much of the brunt of things and not like refilling the cup. And then also just the traumatic things that we have to see, like the worst of humanity,
Yes,
violence and all of these other things that happen. It takes a huge, huge mental and emotional toll on nurses.
it does. It does.
It does. And the pressure, like that we talked about, previously, but the pressure to have to deal with that situation and then also turn around, leave it at the door, and then be able to kind of straight face it to go into your next room to take care of that. Like that is a really hard pressure to have to stay strong when everything just feels so heavy. So yeah, we just want to really like touch on that. Do you have any words of wisdom, advice, anything like that, Felicia?
Absolutely. For me, talking about it helps. It just does, instead of keeping the everything balled up inside, talking about it, but it's always about delivery too when you're talking about things. Praying, honey. Let me tell you something. It was nothing for me to go to the chapel. I would take that little break and step away and say, "You know what? I'm going in the chapel because I need a little prayer going for me, so that I don't, put anything off on any patients." I would never want anyone to feel that I don't have any compassion for them, but there is a such thing as burnout. I will be honest with you, COVID really hit hard on most of us. It
Yeah.
really did burn us out. It was the unknown, and I don't think that many people realized being on the front line. We both work in an organization where we dealt with traumas and stuff, but any nurses within the hospital and being on that front line of something that you just didn't know much about, and being head on and facing it. Even though you're trying to protect yourself, you have to remember that we all have families as well, but that burned a lot of people out because it was the unknown of it all and the stress of it all. And even though all the states were shut down, when things started opening back up, the demands on the staff was probably one of the hardest things in my entire nursing career that I had to deal with. And I know many of my fellow coworkers had to deal with. We lost many nurses that decided this was no longer for them, doctors that they decided that this was no longer for them, surgeons that was like, no, I can't do this. Because you know what? We all take an oath, and to watch people come in, walk in some and not walk back out was not easy. Not have your loved one there was not easy. And I know people were angry at the medical staff, but sometimes we have to put ourselves in this other person's shoes. This was something good. This was a pandemic that none of us understood, knew anything really about it, didn't really know what to do to protect ourselves. And it was very scary, and there's no other way to put it, but the emergency room especially took a big hit with that. And this started burning out. I don't think people really realize how significant that it did. A lot of us are pretty traumatized from it. But, thank God that we made it through COVID. But just know that we do suffer from your burnouts and things because we do get these patients. You think it's always like you see on the TV, all these emergencies, but we are dealing with a lot more of your high utilizers coming in and out to a point where we know them. They know us. And sometimes that can take away from this patient over here who's really, really sick. But then there are those who, after COVID, who maybe didn't really have those mental health issues that COVID did something to them, probably did something to the nursing staff, the whole healthcare staff as a whole. And there's mental health that had to be dealt with in that situation as well. So that's why this is a big deal. Something really that's huge that we have to discuss is mental health. It's very important. So that's kind of really my take on how I feel about it.
Yeah, I feel like we haven't really talked about like just that big gap in history of COVID and what that really did to healthcare because it
Yes,
really changed healthcare a
changed
lot
it. It did.
in a huge way.
It did.
And I think sometimes that can be hard to kind of explain to people, but the toll it took on healthcare workers, having to deal with this illness that nobody really knew anything about. There's a lot of unknowns. You didn't know how to treat it properly, how, contagious, like all of these different aspects.
Absolutely.
We're still dealing with effects of like long COVID and just a lot of different things have played into effect with this. And it's just really, really, really burnt out healthcare workers.
It
I mean,
did.
working
A
long
toll, and
shifts, not knowing, what was going on, if they were bringing it home to their families. They had, their coworkers getting sick. I know Felicia did get sick early on with
I was
COVID,
sick.
like she was one of them. And it took a huge mental toll on
It
people. And
did.
I don't
It
think
did.
people have really recovered from that, and not only
No,
did it change healthcare workers, like, it really changed and affected the world, like, and how we have moved past that and moved on. It's just taken a lot of toll, but I think, one of the things that we both share in common is obviously, prayer and faith, and that even when we're running on empty, God meets us right where we are. He's not asking for perfection, just presence. So I think that's always a great thing to anchor back to is just knowing that when you're at your wit's end and you've kind of had enough is just turning to God and praying to him
absolutely.
and talking to him because he just wants you. Like he loves you. He gave his only son to, die for us and our sins. Like he just wants a relationship with you. And if you can lean on him, that is going to be a huge like self-care moment for you.
Never turn his back on you. I
Mhm.
promise you. Always gonna be there for you when nobody else is. Trust me. Trust me.
So if you're ever feeling low, obviously there's wonderful helplines out there, but
Yes.
the biggest one that you have is really something and someone you can turn to at any moment in time and just praying to God and talking to him and having him be in your life is it's a game changer. It truly is.
And also, don't forget about your employee assistance programs that are offered if you need that. Don't ever be ashamed, if you need to talk to someone, do it. It's really important. So
Yeah,
that's
we've
my
talked about this before. Like, you can't take care of others. You can't be your best self if you're not taking
yeah,
care of yourself. So
absolutely.
it is really important to find ways to like unplug after hardships or a hard week, finding ways. And, I talked about this before, like healthy versus unhealthy ways.
Right.
Nurses like to, do a lot of unhealthy things, but,
Right.
really turning to, eating right and exercising and
Sleeping.
sleeping. Oh my God, especially at
Sleeping. Your
night.
brain needs rest.
Yes,
Sleep.
yes.
Laugh.
Laugh. Yes.
Laughter is the best
Part
medicine.
of it can be turning into us every week.
Yes, it does. Absolutely.
That I think, we talked about it earlier, like, you become a family with your
You
fellow
do.
team members, like, you really become a family, like, they
You
are
do.
truly, a lot of times, the only other people that can really understand you, even nurses that maybe aren't outside of the emergency room, but, like, really leaning on your coworkers can be huge because they actually know firsthand what you're going through.
They're like, I'm telling you, they're your second family.
Mhm.
I am here to tell you that they are. And no matter, even if you are no longer right there in the trenches with them, they are still forever your family. I am a living witness of that right now because My ER family is still there and along this journey, right along with me. And that is why I am truly, truly also feel so blessed. Just all the people that I've known over the years, right there with me. And it's because they were my emergency room family. Like, honestly. So know that they're there for you as well.
Yeah, I mean, I feel like you're a true testament to, really building rapport with your coworkers, especially in larger departments. Like smaller departments, it can be easier because you're
Right.
kind of all in it together. But, if you work in a larger department, that can be a little trickier. But really building rapport, like asking coworkers after traumatic incidences or when something's going on and be like, hey, are you okay? Like, do you want to talk about it? Just kind of like taking a little extra step to make sure that like everybody's okay because
Absolutely.
most of the time we're not, but we just
Not
think.
okay. We
So,
just look like we are, but we're really not, you
yeah, and
know?
it goes a long way. Like Felicia said, she has, a second ER family. I have a second ER family. Like they
We
become
do.
who you rely on. And even when you leave, you don't really leave each
You
other.
don't leave them.
So it's really important. The other thing was kind of like a lot of talk now about like self care, but also like setting boundaries. And I feel like that's really
Absolutely.
important because I'll tell you, I burnt out a while ago too because I was constantly working. Like bills got to get paid. I need to make extra money. I got to work overtime, 5 shifts a week, whatever that looked like I was doing. But that can also lead to burnout because if you're not taking that time to rest and recover after 12-hour night shifts is what I was doing at the time, like, not sleeping, not eating right, not being able to do all of those self-care things, like that also contributes to that burnout. So, setting those boundaries with yourself about like I'm maybe only working one extra shift a week, like I can't be doing 2 to 3 extra shifts or whatever that may look out, but really being
Right.
able to kind of set, boundaries and stick to them.
And finding something like for me, I'm forever an ER nurse, but I also, I felt like I was getting to a point of losing compassion and empathy. So I went into plastics as a nurse and learned how to be an OR nurse and regain those things back, which then made me really appreciate my job as an ER nurse even more because you have to remember ER nurse is my security blanket. Like that's something that I feel great about and I'm always learning, no matter how many years you're doing it, medicine constantly changes and just I love that aspect of where new info comes in and new ways to do things
Absolutely.
but finding something that was gratifying for me while keeping what my comfort was and what also was it doesn't make me but it's just something that was just really satisfying for me when patients would come in and they would be so sick and then we would do all these things and we would watch them turn around there's something about that for me that just I almost felt like Superwoman, you know? Like the team, like the whole team was like, we were all like Superman, Superwoman, whatever, getting it done. So, but when you start to get burned out and losing that compassion and stuff, finding something to help get that back because you don't want to be that person that's looking at somebody in the grocery store all frowned up because you're like, I can't stand people. You don't ever want to be that person. That's not who I am. So me going out there and finding something to help combine the two so that
Right.
I could get it back was the medicine that I needed, and that's exactly what, worked for me. So you finding what works for you.
No, it's so true because I've definitely felt like that before, even probably recently, where you're just like,
Yeah,
doesn't, like kind of like it doesn't matter what I'm doing, nothing's like helping. And I feel like a lot of ER nurses can feel that way too. You have a rough
absolutely.
shift, you have 2 rough shifts, you have three, you start having all these like rough shifts in a row, and you're just like, what am I coming into work and doing this for? Like, you
Right,
get those patients who are just yelling and screaming and it's just complete chaos day after day. And I think that, obviously takes a toll on somebody,
right,
but, kind of finding that gratitude, like you said, and maybe that's, outside of healthcare. Maybe that's, something different, but really taking that time to like look out for yourself. Cause, at the end of the day, like we went into nursing, we talked about this before, hopefully for good reasons because we want to help
Absolutely.
people. But if you
Absolutely.
come to the point where you can't help anybody because you're hurting so bad, like you need to deal with that.
Find what absolutely, and it's okay.
Yeah.
And know that it's okay, and you're not a failure. What you're doing is doing the right thing. We don't want you to be coming to work where you're just, like, very dissatisfied with your job and you're hating life because what good are you gonna be for the patients? What good are you for yourself? It's
Yeah.
very important.
And it's
So
just hard too, because once you get into like a negative cycle, it can be really hard to get out of it. But all that negative cycle does is keep perpetuating and
it
making things
does.
worse. So,
It
whatever
does.
lifeline you need to grab onto to get yourself out of the negative cycle, it's going to make a world of difference for you, your patients, your teammates, whatever that may be. But you got to find a way to get out of it because
And
that
surround
negativity
yourself
is,
around positive people. Okay? Because it's really easy to get wrapped up into the negative. It's easy to find that group of people that's very negative. But when you get in a group of people that are positive and make you see things in a different way, it's amazing. Negativity will suck the life out you. We got enough going on in this world. You don't need that. So surround yourself with positivity and around positive people. When you're feeling down, talk to somebody. Know that it's okay. You know, we all have our struggles, and it's okay if you need to reach out to a therapist. It's okay if you need a prayer group. It's okay if you need to vent to a friend, but talk to somebody. Don't hold all of this in like that because you know what? The mind is a terrible thing to waste. Like you can spiral and not even really realize it. So just talk to somebody.
yeah.
Reach out to one of us if you need to.
Yeah.
A
Literally. We're
letter
on
and a
social media.
chat.
If you need to talk, talk.
Do it. I am always here. Brittany is always
Yep.
here. We don't want anybody sitting and suffering alone because it's not easy. So because it's ER Nurses Week, my ER nurses out there, my new nurses out there, my old nurses, seasoned nurses out there, if you're feeling at all that you feel like you're just getting to this point of not being able to cope, or you feeling like, well, maybe I don't belong, listen, take a step back, talk to someone because sometimes it's all in our head and you are more than capable of doing whatever it is that you want to do. So just know that those are my words for
No, it's kind of funny. So, we've had a couple of newer nurses in the ER, and we were just doing some like skill stuff with them the other day. And, I feel like there is a lot of pressure on new grads to come out
right,
and to know things and to be able to perform at these high
right.
standards. And, I feel like at the moment, that kind of like fight or flight kicks in. They're like, rushing. And I'm like, all right, this, take a deep
You
breath.
got this. Take
You
your
got this.
time. There's no pressure
And
here.
then it was there. So
And
I
then
think
it's
even if
there.
you need to take that moment to just be like, take that deep breath and be like, you do know
You
this.
got
Like,
this. You
don't
got this, baby.
don't
Don't let
second guess.
anybody tell you you don't. You got this. If this is really what your heart desires and this is what you want to do, you don't let anybody tell you otherwise. Make it happen.
Yep, just keep doing your best and look out for yourself because it's a hard world. And we're not even talking about nursing. It's
General.
tough out there. We've said it before. There's a lot of different stressors outside of the work
Yes.
environment that
Yes.
makes this day and age extremely tough. It's a lot to deal with on top
Yes.
of dealing with all the things that you have to deal with nursing wise.
Imagine nursing world and you're dealing with something other things. We all have things that's going on. You know what? My situation's no worse than the next. So
Yeah,
just know that.
just find your people, find your passion, find your way to refill your cup. They're all very important for you to maintain like your best life so you can continue to be the best person, be the best nurse for your patients.
All righty.
All right, girl. It is a drop my
Drop this
stethoscope
stethoscope
moment.
moment, everybody. You know what that means.
Yes.
About whatever is going on with you. What's up, Brittany? What's your drop the stethoscope moment?
All right. Well, it's ER Nurses Week, and this episode's going to air after ER Nurses Week. But I do just want to say that I'm very grateful to have been and still, in a way, am an ER nurse. very lucky and grateful that this is the profession that, I get to be a part of. And, a couple of the things like I have going on in my personal life is MedMax EDU is, kind of part of our Hold My Stethoscope family. We offer discounts this week for anybody looking to expand their trauma knowledge. And by the time this episode airs, my basic EKG book will be out. So if that is something that any fellow nurse is struggling with,
Wow.
please check it out. I'll post it on my social media to help you be able to read and interpret rhythms easier. So definitely looking out for that and just, staying very, very busy.
Busy's good.
Yeah, that's a basis. Continuing my
Right.
health journey, trying to get different,
Yeah.
things up to help with healthcare education with my other business. Looking to do some more pediatric education in there as
Good.
well. So,
Good.
and then just continuing to have fun just talking with my girl on this podcast. It's so much
Yes.
fun. Like we both love it so much. And we're
We
just
do.
once again very grateful for everybody who's tuning in to see us and looking at ways, hopefully by the time this episode drops, to be able to get you more involved in the show because
Yes.
this may be started by us, but it's about all of us out there. So all
Absolutely.
right, girl, what's your drop this episode
Well,
this
and
week?
mine, okay. So remembering, your worth isn't measured in how much you do, but in who you are. You're a light in a dark place, and that's what matters. For me, it is continuing on this journey of healing and recovering because I do see a light at the end of this, and I do see that I will beat this, and I will tell you all, we will party. Okay, we will party. And what I always take and tell everybody, and I'm sure I've told you in a previous episode, let's not focus on things that we can change. Okay. If it is something in our control, please, please make the change if you can do it. There are things that are not in our control, but you know what? My faith is what gets me through those things that I cannot control. So for me, it is just continuing this journey, thanking all of you that are part of it. You all are my everything. You're very special to me. I thank each and every one of you who stand by me, text me, send me messages in Messenger, on Facebook, Instagram, call me, visit me. I love, love, love each and every one of you. Even the messages I receive from your families through you. I thank you. I am so grateful. My family and I appreciate you. I almost don't even know. I'm very overwhelmed with the love because I've often asked, how do I deserve to have so much love and support from so many people? But then again, I would do it as well and be there for each and every one of you. I mean that, like,
That's the thing, Felicia, is I feel like it's a really important part is you get what you give. So in a way, you're getting exactly what you've given in the past.
that
So
means the world to me because I didn't realize that that's how people saw me. And though just what people have done for me, I can't even express the gratitude that I feel. I feel that people have taken this on personally. People's family members that I don't even know have been there, have sent me messages, have been there to make sure that I am here. And it's because of all of you why I am here in New York receiving this treatment at one of the best places in the world. And I just thank you just doesn't seem like enough, but I love all of you so much, even those who I've never even physically met in person. I love, love, love you because you loved me, you loved your family member enough to be there for me and my family. And I just can't tell you how great that makes me feel. So, I may have wanted to be that FBI agent. I probably wouldn't be getting paid if I was right now. But I am very grateful that I instead am an emergency room nurse, period. Because look at my whole nursing family. This is not just ER nursing. I gotta give kudos to the whole nursing staff at the organization that I work for, because when I say people came for me, not just nursing, doctors, respiratory therapists, advocates, social workers, every text, everybody came for me in this organization and just showed me the love. And I just want to tell you guys, I love you from the bottom of my heart. I really, really do.
It's just
Happy Nurses Week, everybody.
it's just been amazing. Just I'm so glad we're doing this again. We talked about this Hold My Stethoscope podcast, but it's been the funnest part has been having you be able to tell your journey to
No,
people. It's been
in
amazing.
the beginning, people were like, "You're gonna have a testimony." I'm like, "I'm not gonna have a testimony." It's just I'm still looking at people like, "What are you saying is going on with me?" But, who knew that at this moment, at this time, that I would be able to share my story, and if it helps one person, then I feel like I've done my due diligence. So, thank you for hearing my story and listening and wanting to hear my story, and I will continue to share the good, bad, and indifferent with you as long as you wanna hear it.
Yay.
Thank
Well,
you
we
guys
love you
so
so
much.
much. And once again, like Felicia said, happy ear nurses.
Happy ER Nurses Week, my ER nurses. I just love each and every one.
We love you. We see every
Celebrate you.
day how hard you're working. We
Thank you.
celebrate you. We are appreciative of you. We thank you so much for continuing to do the hard
Thank
work that
you.
you do.
And
So
that's the truth.
thank you, thank you, thank you. And
So
once
until the
again,
next episode, everybody.
thank you to everybody who's listening. Don't forget to subscribe, like, comment, share, all of the things that keep us
Yes.
going. And we
Hold
cannot
my stethoscope.
wait. Yes, hold my step. Go. Love you guys. Bye.